So I'm Victoria Graham. I'm originally from the Cleveland area, so really like the suburbs of Cleveland, about 30 minutes east. And then I came out to Northwest Ohio for school and then just ended up staying in the area really because of work. So I ended up staying, working in the field, liking it. So I'm a licensed professional clinical counselor with a supervisory distinction. So basically I'm a counselor. I have a master's degree in clinical mental health counseling. And right now I work at a community behavioral health agency, like an administrative services. I'm the regional director of our services for 3 counties. So initially I was interested in mental health. I did my undergrad in psychology. My mom went to school for psychology and she worked at a crisis center when she was in college. So I was always interested in that. I would hear stories. So when I went to college, I was like, okay, I'm going to be a psychologist. And then I ended up doing an internship at a local crisis center. And then that's when I really realized what working in this was. So before it's just kind of, I'm interested in human behavior. It seemed so cool that I could help people feel better. That's kind of where it started. I had experience with like family and friends with mental health and substance use, but I just never really put it together like that. I just was interested basically in it. And then once I started working in it, I realized how much of a need there was and how much of a need there was just for people that felt comfortable working with everybody and comfortable hearing stories and kind of sitting in that discomfort. I think that's a big thing. Everyone wants to like help or fix, but a lot of it's just being there and listening and saying to somebody like, I care what you have to say. And that seemed so like natural and easy to me. And I saw how much just that helped. One case in particular, I think that where that's when I really understood you can't separate out like what's happening with somebody because they don't always know. So we had somebody that was young, around my age, hadn't really like worked well with anybody, and so I started working with them and just kind of talking to them about like what's going on. And we ended up that it was a pretty severe mental illness that they were having. They were having hallucinations and delusions, but everybody thought that they were just abusing alcohol and that's what was going on. But they were abusing alcohol because they were trying to feel better, understand what was happening, and they were scared and they didn't understand. And then we realized like everything really intersected with each other. So like what is what, and it doesn't matter at the end of the day. Like all that matters is that you can talk about it openly. And I think that sometimes there's too much of a focus on like, well, where's this coming from and what came first? Sometimes you just need to sit with what's happening and how do you like adjust day to day. Then maybe you can try and figure out where things are coming from. But I think it's important just to try and talk out like what's really going on. So that was always really impactful for me because I think everybody had, you try and go in with like an idea of like, okay, I'm going to fix this, I'm going to make this better. But it's like that a lot of times that person has no idea what's going on and they haven't fully even opened up everything they might be experiencing because they might not even think anything's odd. They're like, oh, everyone doesn't feel this way. Like this isn't, I shouldn't have to have life be such a struggle every day. Like that's really powerful for some people, especially that come from, you know, families of generational trauma and substance abuse and things like so many people I've worked with just really don't think anything's strange at all. That's their community. That's what they're from. Like they didn't really realize that people maybe felt better than that every day because they had never seen that in their life. So really just being able to say like, you could maybe feel better than this is really a lot for some people.
Absolutely. Seemed to have been a bit of a theme this week. We've been hearing of people really breaking that cycle because, you know, family members, parents and grandparents, that just is how life was. And it is pretty powerful to see when somebody can break from that and the different life that they can have, and then how it spreads to other people as well. So so you coming into the field in the 2010, early 2010 era where the opiate epidemic is, you know, really starting to rear its ugly head and whatnot. What changes have you seen in the system that have been really helpful for folks?
It's been so much. I think that initially what I really saw people coming in was just so much shame and so much guilt for what was going on, because it kind of became this divide of the people that had been prescribed it, or maybe people hadn't been prescribed it, but they were trying to use it for pain, and then people that had just stumbled upon it in a party, and we had seen just every single person affected by it. I mean, it was no certain demographic. I worked like in a college town, so you had a lot of that age. You had pretty much every age, every race, every ethnicity, everything you could imagine. Any kind of person was coming in struggling with it. And you would just see how scared they were to tell you it. Even though we were supposed to be the one place you could go and talk to about it, they still were trying to give an explanation of it or try and explain. The biggest thing I always heard from people was like, I don't want this either. Like, I don't want to feel this way. I don't want to have to wake up every day and need something to feel like myself, especially with the physical dependence that comes with opiate addiction. a lot of people didn't know that. So when they get into it, they're like, I feel like I'm dying. I know you're telling me maybe I won't die, but I think I'm gonna die. And there's nothing more powerful than like how you physically feel. So that's really hard to tell yourself, it's okay, don't worry. And medication assisted treatment was just still so new, and it was scary, and there wasn't tons of clinics in the area. Luckily, we have a lot of resources now that have come up, but at the time, I remember when we opened our clinic, it was like, how do we do this, and what does this look like? And then at that time, I was doing assessments, so when new clients were coming in, I was getting them linked to services, and it was just this flood of people coming in, and the thought of all these people were just out here struggling this whole time with nobody to talk to, and I would say most of them, it was a secret. They were hidden, or maybe one person knew, and so seeing them being able to come in, and then just the beautiful progress that can happen. So now seeing how many people are having these wonderful careers and families and lives, and a lot of them we still have in our clinic. So there's a lot of people that are on long-term medication-assisted treatment, or that are still linked to peer support or some sort of a therapy services, and seeing that that's okay, that it's not going to be just like a one-time fix, that maybe this is something they need to continue to manage for a long time. But it's just been beautiful. I mean, there's been obviously sad cases and people that didn't make it, but most of the people now just have these like beautiful full lives, and you can just see from the day they came in to how they are now, just this glow and light back to them, and it's just the most beautiful thing to witness.
Absolutely. Yeah, that transformation is unlike anything else. I mean, that's pretty much the reason this entire project started, is seeing so many lives change, and that ripple effect is just spectacular. So you talked about some of the things that have changed and have been added. What would you say for some of those marginalized populations that are out there, different races, different ethnicities, the LGBTQ community, how are you seeing those folks being supported, and what do we need to do more?
Yeah, they're not supported enough, honestly, is the truth about it. And I think that the thing, I actually was just talking about this last week. I was at a community event, and the problem is that they don't have people from their communities that are trusted. And so a lot of these people have had very real experiences of being discriminated against, or being in healthcare systems that aren't treating them fairly, or they've had that of their family members. And so they're scared to come into it, and they don't know what to expect. And then they come in, and there's people that aren't from their community, that don't speak either the same language of them or the same kind of cultural language, that really don't understand the story that they're telling. And so it's really important for them to feel like they're going somewhere where it's trusted and it's safe, and they're okay to open up about what's going on, because in a lot of these communities, them being open did lead to some sort of violence or persecution or something against them, and we have to acknowledge that. So I think the biggest thing that we need is people from those communities entering into the helping field, getting licensed, things like that, to be able to provide therapy, but also really an increase in people that have lived experience doing this work. So a lot of the organizations I've worked at, we have a lot of individuals that have lived experience. And I think that both is nice, but it's really important to have somebody be able to say, I actually do know what you're going through. Or we have a lot of people that say, like, wow, I could be a counselor too. Yeah, look at this person, 10 years ago, they were in the same exact spot you are, and look at them helping all those people. And it really can help to put meaning behind like the struggle people go through. I can use this to help somebody else and make it easier, but there's just not enough people coming into the helping profession these days. We just keep seeing, at least in the state of Ohio, less and less people entering into it. And I think that we really need to encourage what's so important about working in the community and giving back and reaching to these people, because yes, we have services, but it's scary and you don't really know what they are. And there's not a great place to just ask a question of, what if I walk into this building, what's going to happen to me? It's important to have somebody that's your next door neighbor to be able to say, hey, I've walked into this building, or I know what it's like to go in here, and it's really okay, and this is what you can expect, and maybe this part's scary, but then this is all right. Because when you walk in, it's just a medical facility, and that's a scary thing for a lot of people for very valid reasons.
So we've talked a lot about the individual and whatnot. We know families are, devastated by some of the by this disease. Mm-hmm. How have you seen families being helped, and that follow up of what do we need to do more to be able to support families?
I think a lot of it is asking that individual what level of comfort they have with family to bring them into their treatment, because a lot of people don't even think that's an option. And so really opening that up of, do you want to bring your family in here? Are you ready to do that? And not just looking at family as the family you were born into, but also your chosen family. Is there somebody that you want to bring into this that maybe isn't your mom or your dad, but somebody you think of like your mom and your dad? And that's okay. We can involve them the same way, and we can look at your relationship in a similar way, because there's so many people that are coming from those generations of not either having a parent around or something like that, or they weren't helpful to them or not supportive of them. So it's really letting the individual decide who is their family to them and how do they want to include them. And then for the families that I would say especially that are trying to understand better, I think that it's important to have resources for them. So NAMI's a wonderful organization that does so many fantastic things, and I know they partner with us a lot. But I think also like hearing from the families to see what kind of support do you need, what would be helpful for you, like when, working in a treatment facility, what would be helpful for you when you come in, what kind of information would you want, what are we missing? Because we might feel like everything's okay, but is there something that you feel like you would need to be able to understand this better or to be able to support better that we haven't thought of? So I think it's always just important to hear the feedback from them, but I don't know if there's a great system to get that feedback right now.
Yeah, absolutely. So last question, what is, if you had one thing that you really feel could make an impactful change that, either there's just not the funding there for it, or logistics have been struggled to figure out, but what's the one barrier or the one challenge that you feel like we really need to start addressing like ASAP?
I think it is like what you mentioned before, getting people to want to work back in community centers. So working in community behavioral health is what we call it. Usually that's funded from like some money from the state that comes in through the county that has these people that will go out in the community. So like we'll go into people's homes, meet them where they're at, or we would meet them at a coffee shop or wherever they feel comfortable that they want to be. And working in this instead of we've seen a lot of increase of like private practices or these more for-profit places. The not-for-profit places that are really in the community and with these people. I think it's important to try and attract the staff to work with them because our clients are coming and we don't have enough staff of any kind. And that's, looking at having peer support, having licensed staff, having medical staff, even just having a really great administrative support or front desk person that gets it. And when they come in, they really understand that maybe that person's having a bad day and it's not about them. You don't know what happened before they walked in these doors, and it took a lot for them to get in. So I think that having the staff that want to do the work, because that really matters for how they treat people, to understand that I took a bus here and I'm 15 minutes late and that was really hard for me, and I don't need you being upset with me that I'm 15 minutes late. I just need to cry now because that was really hard and I made it all the way here without crying. This is my safe place. So I think really just getting the people that want to do the work, that really trust in the mission and want to, really help people get better.
Yeah, absolutely. Well, thank you so much for taking time out of your, really fantastically busy day, and you get to work in so many different communities, and being a regional director, being able to see things from a bit of a different perspective, but also having that experience of working one-on-one with people and in the community. That's such a great combination to be able to have. So, you guys are just doing fantastic work. So thank you again so much.
I appreciate it.